So the case study is discussed about a 60 years old Malay male named Alex and residing in Johor Bahru. He presents with multiple cardiovascular risk factors, including hypertension, hyperlipidemia, and mild liver dysfunction. So his condition can managed by both treatment, pharmacological and non-pharmacological intervention. So the goal of this explanation can be analyze his clinical profile, treatment rationale, and lifestyle implication. So we go first to their background and family history. Alex is work part-time as a driver and he does not smoke or drink alcohol, but his lifestyle is sedentary and his diet is high in fried food and sugary drinks. And his BMI is 28, which is overweight. And for the family history, his father died of myocardial infarction at age 17 with a history of hypertension. Brother had a minor stroke and suffer from high cholesterol. Mother is diabetic and still alive at age 18. So, if we conclude the case study, Alex has a strong genetic predisposition to cardiovascular and metabolic disease. His lifestyle further amplifies this risk, making him candidate for early intervention to prevent major events like a stroke or heart attack. So for this section, we talk about the symptoms of cardiovascular based on Alex's case study. So Alex reportedly have high blood pressure that can cause headache, dizziness, and fatigue. Hypertension is, often may present with non-specific symptoms such as dizziness and fatigue due to increased cardiac workload. Headaches may occur during hypertensive spikes but are not reliable indicator. So Alex's dizziness and fatigue suggest poor blood pressure control. These symptoms are subtle warning sign of vascular strain and possible end organ involvement of a high blood pressure. For the next symptom, he reportedly have hyperlipidemia. Hyperlipidemia does not produce direct symptoms actually. Instead, it contributes to the development of atherosclerosis, plaque buildup in arteries, which can eventually lead to angina, stroke, or myocardial infarction. Although Alex has no chest pain, his elevated cholesterol and family history place him at high risk of future cardiovascular events. So next, for family history, genetic predisposition significantly increase the risk of cardiovascular and metabolic disease. As you guys can see, father died of heart attack and his brother had a minor stroke and mother has diabetes. His risk is compounded by both genetic and lifestyle factor. So if you look at lifestyle, his can lead to high risk of cardiovascular because his actually excessive body weight, increased cardiac output and vascular resistance, lack of exercise, reduced endothelial function and HDL level. A poor diet contribute to dyslipidemia and hypertension. These modifiable risk factors worsen his clinical profile. Without lifestyle changes, his pharmacological treatment may be less effective in preventing long-term complications. Alex was prescribed 4 medication on 17 July 2022. Each drug target a specific aspect of his condition. So we have Heptal 500 mg, Cardiprine 100 mg for aspirin, and Coveram 5/5 mg perindopril plus amlodipine, that's a combination, and the Crestor 10 mg rosuvastatin. So for this slide, tell about pharmacological treatment. Each drug has specific indication and mechanisms of action that support his overall treatment plan. So the first one, we have Heptal 500 mg. It works by donating metal groups in metabolic reactions. So in Alex's case, Heptal help reduce fatigue and support liver health during long-term cardiovascular. So possibly side effect happen include nausea, insomnia, and mild gastrointestinal upset. So the second one is Cardiprine 100 mg. So this is for aspirin. It inhibits the COX-1 enzyme in platelet which block thrombazone A2 and prevent platelet aggregations. Alex has a strong family history of heart attack and stroke. So aspirin is used to reduce his risk of clot formations. Side effects include gastric irritation, bleeding risk, and bruising. So the third one is Coveram 5/5 mg. This is a combination of an ACE inhibitor and calcium channel blocker. So perindopril lower blood pressure by blocking the conversions of angiotensin 1 and angiotensin 2. So this actually basically reducing vascular resistance. This dual therapy is prescribed because Alex's blood pressure is uncontrolled condition. So it helps reduce cardiac strain and improve blood pressure control. So it's a common side of this medication is dry cough, dizziness, and hyperkalemia. And the fourth one is Crestor 10 mg so for rosuvastatin. It inhibits HMG-CoA reductate, the key enzyme in cholesterol synthesis, which lower LDL cholesterol and stabilize atherosclerotic plaques. Alex has a high cholesterol and a strong family history of cardiovascular disease, so Crestor is effective in reducing his long-term risk of heart attack and stroke. Side effects might include muscle pain, headache, and rare liver enzyme elevation. So in addition to medication, Alex cardiovascular had required lifestyle changes and behavioral strategy. So the first one, lifestyle modification. So Alex is advised to adopt healthier daily habits. So the second one is medication adherence. Alex must take all prescribed cardiovascular medication consistently. And the third one is healthy mental and emotional habits. Alex is encouraged to practice mindfulness meditation or yoga. So the last one is education and self-management. So Alex should learn about cardiovascular risk, factors, and how to manage them. So basically, it's a non-pharmacological treatment, complement medications, and address the root cause of cardiovascular risk. So for Alex, these strategies are essential to prevent future complications and improve his qualities of life.